Hey everyone, welcome to another episode of Ask Dr. J, and today we're going to talk about flossing and the importance of cleaning between your teeth. So just about every day in the hygiene chair or in my chair, I get someone that asks, how do I floss? Am I doing a good job? What about these little picks? Can I use those? What's the best way to clean between my teeth? So let's go ahead and talk about some of the basics, some techniques, some other adjunctive or additional ways that you can do cleaning between your teeth. So first, picking a floss. There's all kinds of flosses on the market. There's mint, there's tape, there's wax floss. And my answer to the question of what floss is whatever fits best for you and is most comfortable. I happen to use Glide. It's a floss tape. It fits nicely between my teeth. I don't get paid by the company, but it's just what works for me. And we also use it in our practice quite frequently. But for you, you may need a thicker floss if you have bigger spaces. You may need a waxy floss. So it just depends. Whatever works best for you. Try different ones until it's most comfortable. Technique. So technique's really important. It's not something where you can just pop, and put the floss through each spot. I want you to think of these three terms. It's snap, wrap, and scrub. Snap, wrap, and scrub. So what you're going to be doing is I want you to lightly snap or even kind of bump the floss through the teeth so you don't jam it into your gum because that's uncomfortable. Then you're going to wrap the floss around the contour of the tooth and then you're going to scrub up and down. And as you're doing that, keep in mind, except for maybe the last teeth, if you're going to wrap those, you have to wrap in two directions, this way and this way. So there's two surfaces to wrap and scrub up and down. And the reason this is important is because if you just pop the floss in and out, your teeth really have a triangular shape, and as the floss goes in, you're not going to really get the plaque off the sides of the teeth. And you'll actually see the floss will go beneath that little pink triangle of gum, and it will clean the plaque off there. So it's one of the steps that not a lot of people know, so I just want to make sure that you understand that technique, how to do it, and don't get crazy about it. So I know that flossing is something that you're going to be told at the dentist do every single day, and yes, you should, but maybe if you work up to that. So what do I mean by that? So when you're working on the technique, do it maybe once or twice a week where you sit in front of a mirror for 5 minutes and work on that until it becomes muscle memory. And you have to do it and see it to get the proper technique. And maybe the other days, because we got busy lives, go through it fast just to do something. I would rather you floss properly, and some people may not like this, especially hygienists, but I would rather you floss properly 3 times a week than go through the motions every day. You're going to get a better result and it's going to be more healthy for you. So what about some of the other items that are for sale? There are these little forks that have plastic with a little piece of floss. Those are good if maybe you can't get your fingers in properly to wrap the floss around. You can actually take that and you'll pop it through and kind of push it against the side of the tooth and scrub. So that's another tool that can be used. If you have a retainer or a bridge, there's floss threaders that looks like a little piece of nylon and the floss goes through it and you can simply bring it beneath your retainer and use that to get underneath. What about the picks? I hear about these and see people that bring these in. So there's things called proxy brushes or interdental picks, interdental stimulators, all different types of products that are sold on the market. And what it comes down to is whatever one of these tools that you can use to get between your tooth and remove the plaque and it's not going to damage your gums. And the way that you'll know that is if you're doing it and it's really hurting, then go ahead and stop. Now what about bleeding? So when we floss, typically you're going to get a little bit of bleeding, especially if you don't floss perfectly every single day, which I don't, so I see a little bit of bleeding when I floss. And what I want you to do is when you see that bleeding, make sure you keep going. The bleeding doesn't mean stop, it means keep going. You're getting the plaque off, and plaque is what creates inflammation, which creates the bleeding. Again, unless you're jamming it in, that's a different story. That's where it may be causing damage. So those are the other different types of tools. And one other thing that we haven't mentioned yet is water picks. These are great adjuncts for some people who can't floss for whatever reason, maybe disability, just can't do it. Definitely use your water pick. If you have an all-on X or all-on 4 in our office one-shot smile, a full implant row of teeth, you're going to need to use the water pick because it's very difficult to get floss up there, and they do a good job. Everyday situation, my recommendation would be to do your flossing or using your brushes between the teeth and come back with the water pick as kind of like a power washer. So this way you're basically rubbing the material off and then coming back with the water pick to wash it off secondarily. So again, lots of things, don't want to overcomplicate it, but really just make sure that you're doing something, that you're getting better with that technique. Snap, wrap and scrub, and make sure that you're also asking your dentist when you come in, how am I doing? So hope this was helpful, and thank you for watching another episode of Ask Dr. J.